Hi, it's Dr. Noel Williams, March 1st, 2021, COVID update. This is attempt number 2. Kim said the last one got a little bit too crazy. So anyway, summary. Cases are down 54,000 in the United States, 380 in Oklahoma. Sure, it was Sunday, but ultimately cases are going down. It's going to be like this. Little bumps and starts, but overall it's going to go down. We are going to hit herd immunity between April 1st and May 1st. Dr. Markey's article, which I posted, which then had the fact finders of non-scientific people, or that's not true. They were academics not in the real world who selectively pulled data, which I could pull just as much data to say, no, you selectively picked data to try to refute Dr. Markey, except for the fact that you picked stuff that was old and not new, and all the current data shows the complete opposite. So let's go over the things that they criticized Dr. Markey for saying there is herd immunity. They said, one, seropositivity doesn't mean you're prevented from reinfection. Baloney. Fake news. Just a paper in JAMA from last week, the International Journal of the American Medical Association clearly showed that people with prior infection have at least a 90% immunity rate long term, and the 10% who got reinfected had very minimal to no disease. What they did is they did this really cool test, because if you have antibodies? If you have antibodies, how do you see a new infection? Well, what they did is they looked at ribonucleoside acid amplification testing. So when you get a new infection, the RNA is going to come up, okay, from the virus. So you start checking the blood periodically, and you amplify to see if you can detect any. And so when you get that bump up, it means there's a new infection. So they did that in thousands and thousands of seronegative people who are the case controls, and thousands and thousands and thousands of people who are the seropositive, but who had lost their antibodies at this point. So, and everybody pretty much lost their antibodies at 3 months. They followed the patients for 3 or 4 months. The summary was 3% of the seronegative patients, people who hadn't got infected in the study period. 0.3% of the previously infected got a rise in the RNA, which meant a new infection. The interesting thing was, so that's a 90% reduction in infection, which matches as they said, the vaccine data. Big surprise. And they didn't get sick. Most of them didn't even know they had it. So it just shows you either have full immunity or nearly full immunity, or essentially asymptomatic level of infection once you've had the infection. So there's that. There's plenty more, but that was just published. God forbid any of these people would read anything that actually went against the narrative. So one, they don't get reinfected, and two, they don't get serious reinfections. Number two, they ignored all the cross-immunity data and all the T-cell data and acted like the T-cell data didn't exist. There's tons of data showing that the T-cell data exists, and that's the whole thing. The Johnson & Johnson, the Moderna, and the Pfizer studies, one of their high points is that it turns on T-cell immunity. The virus obviously causes T-cell immune reactions, and we know that from other studies that the T-cells are activated and they have memory. And so, again, ignored all of that. They questioned some of his statistics, which were silly. They ignored all the cross-immunity data from MMR, the measles, mumps, and rubella. And if you just do the math, which I will put out in a separate written post, it is obvious we are going to be at herd immunity between April 1st and May 1st. And we have 75 million people vaccinated. We'll be about 120 by April 1st. We'll probably be at 160 by May 1st. It is just impossible to not have herd immunity at that point. And so we're going to have it. Does that mean there's no cases? No, it means the case numbers are going to drop. I mean, we're a huge society, lots of pockets, but ultimately the case numbers are going to drop to the point where we can adjust society, okay? There's no point in continuing this baloney because we got to return to normal. The only reason we don't return to normal by May 1st across the vast majority of the United States is power and control. It is authoritarianism. It's the rejection of the American way. It's the loss of our civil liberties. There is very clear evidence that there is safety coming, and we don't need to wear masks, and we don't need to socially isolate anymore. And it's that simple. And that's without even factoring in vitamins and supplements, which you need to be on anyway long-term for your health. But it is that simple. It's black and white. Anything else you read or hear is a lie until proven otherwise, because the data I'm reporting is science. I mean, you can be like Fauci and wear 3 masks, even though you only need 1 mask for the humidity. You can ignore the fact that the biggest reason it fell in the spring was something we didn't know. It was just seasonal wind and humidity changes. So it's going to fall in the spring no matter what, but it's really going to fall anyway because of the vaccines. So the point is, there is no scientific reason or societal reason of reality to keep us shut down anymore. There's none. There's none. So there's only one reason to: power and control, power and control. And that's what we have to start. That's my biggest fear with COVID now, is the effort to power and control. So let's use some examples. Okay, you have Gavin Newsom in California, the governor, who lockdown. He gets busted at a closed restaurant eating dinner, essentially. Oh, he wasn't seen eating, but he's in there with a group of people, with the staff. Okay. I mean, it's just the people who are making the decisions do not follow the same rules that they promulgate, like quarantines for different activities. I mean, they don't follow it. It's utter nonsense. Don't tolerate it for yourself anymore. Sorry, my phone's going off. There. So sorry. So that's just that message. Kim, questions. I may go back to some of that because I have some examples. Let me give a couple examples of how crazy society has become and how we've become a snitch society and a society of telling on each other, and we're turning into the Gestapo because the government wants us to, because it's the simplest way to control us. And it's these snitches and this societal stuff is about starting authoritarianism. It's that simple. I will post an article from the Chicago Thinker, beautifully written by a freshman with has more IQ points than any 10 people, that defines this. It's long, it's complex, but if you read it, you're going to like it and you're going to get it. So you look at Middlebury, well-known top 3 liberal arts college in the Northeast. A freshman went with a upperclassmen to McDonald's this last week or so, came back on campus. They have 0 cases there, almost none in Vermont, low. They find out about it. They send him home because he broke the rule. Okay, let's think about that. I'm all about rule enforcement. I think consequences matter, but does it really matter to send a kid home who went to McDonald's as a freshman? What's the greater good here? Okay, let's think. We're going to increase that kid's suicide rate, depression, and failure rate massively versus torture him. Give him like community stuff to do for the rest of the semester. But no, we're going to be punitive because that's where we are now. Because if we don't follow made-up rules that don't matter, what do? University of Chicago, freshman girl walking with another freshman girl. It's freezing cold. Her period starts. She doesn't have a tampon. This is what happened there. And she's all the way across campus. The girl walking with her's dorms nearby. They walk in. The girl walks into the friend's room, in and out of the room in 3 to 4 minutes, gets the tampon, puts it in, comes out. Another girl calls and reports them. They both get written up for formal COVID violations, even though she was having a period that suddenly came on and she was bleeding. And so we're going to let her free bleed down her leg. That's really nice. Okay, so that shows the people in charge how they've lost perspective because they can only follow the rule without thinking. And they don't understand the consequences of what they're doing and how they're ruining society. But I'll stop on that. So I'm glad I'm in Oklahoma. For those of you who aren't in Oklahoma, I'm sorry.
Okay, so how do you feel about college students getting the vaccine?
College students getting the vaccine, if they have to get it, like my son's going to have to get it, even though he's already had COVID. I mean, they've made that abundantly clear where he goes to college. I mean, we're going to fall on the sword of getting the vaccine. I don't think it's harmful. I don't think it's necessary, though, at all. But I think we're all going to get pretty much hammered, and you get the vaccine, and whether or not you believe you need it, based on the mandation to travel and go to sports events and everything, because that's what's going to happen. It's going to be an authoritarian event. So we can fight it, But unless we get vocal and really push against it, I don't think it's important. And again, keep in mind, I'm for the vaccine. I want everyone over 30 to get the vaccine. I want anyone under 30 who is a high-risk person to get the vaccine. If you're a low-risk person under 30, I really don't think it's as important. If you're a low-risk person under 30, 25, I really don't think it's important for you to get it at all, because we don't really know long-term. We think it's safe. I think it's safe. I can't promise you it's safe. So us older folks who could still get COVID and die from it or have really serious consequences, yes, it's worth it for us. But if you're young and you're healthy and you'll take your supplements, no. I don't think it's necessary, but that's me. The exception being pregnant women. Pregnant women, again, they're high risk. So just think, high risk people, yes, we want you to get it.
So a couple of people's college age kids have already gotten it for various reasons.
I'm fine with that. I mean, you can't undo it. So if wishes were fishes, we'd all be the king or queen of the sea if we could undo what has happened, but we can't. So it's fine. I mean, I don't think it's the end of the world. I'm being a theorist here. It's theory. And that's the thing when you're being a theorist. You can be wrong, and you just got to go, I was wrong. I was wrong. It was totally safe. I mean, 10 years from now, we could look back at the COVID vaccine and go, oh, it's totally safe for little kids to get. I don't see that, because I don't know that I would recommend it to a child or a young person, because I don't have proof that it's safe, but I do have proof that the virus is reasonably harmless. So why would we put them through it?
Why do you have so much more of a severe reaction, potentially, with the second vaccine?
Well, there's a variety of reasons. The primary one is you've already gotten your immune system to recognize the virus. So if you get a second vaccine and your immune system is completely tuned to the virus, which it will be essentially 95% of the time in someone under 55, you are going to have a stronger reaction. If you're over 55, it's close to 95%, so you're probably going to have a stronger reaction. Third, you may have been an asymptomatic infected person you didn't know, and so you got the first one, you really got your immune system up, you do the second one, oh yeah, you're getting crushed with symptoms that are going to resolve, and you're going to be fine, but you're going to feel sick. So that's why the immune system reacts to it. So you release mediators, and the mediators make you feel sick.
What are your thoughts on the vaccine and it causing infertility?
0. It does not. There's no data. I've had a couple people already get pregnant on it. Sorry, it's not working as a birth control method.
Okay, so you talked about the humidity in the masks.
Mm-hmm.
So why would that not translate into the more humid climates having a much lower caseload?
Because it's 100% humidity between your nose and your mouth. And there isn't 100% humidity anywhere. I mean, there may be episodically, but it's 100% humidity right here where it goes in. So it turns out probably when it's super moist and humid, there's probably a lower rate of transference. Okay. And we know from the seasonality study that came out that it was higher wind with fair humidity that caused, I believe it was higher wind and fair humidity, and I may have to check on the humidity level, but there was a role for humidity in the spread and the lack of spread.
Okay, so then these all kind of go together. So there's 3 questions about the antibody test that you've talked about.
Mm-hmm.
Where do you get it? Do you need doctor's orders? And what is a good level?
Well, I think the first thing is any positive level is reassuring. That's the first thing, because you have antibodies to COVID, the spike protein. And we know that at least your worst case scenario with low levels is partial immunity, where you essentially, if you got it again, you would get very mild to no symptoms. And that's probably going to fall into about 5 to 10% of the population max, probably 5, but it may be 10. And then the other 90%, it looks like you're immune. When we look at the average levels in the studies, 250 was the magic number. But I mean, again, that was a whimsical and arbitrary cutoff. I mean, they were just looking at levels 2 weeks after someone got infected. And the thing we know for sure is essentially no one gets infected again in the first 3 months. And by the end of the 3rd month, most people's levels are, 5 or 7. So I think ultimately any level's good, but higher's better. But I mean, ultimately, any level's good. What lab cores, what we recommend, the SARS-2 COVID quantitative antibody level. So that's what we recommend.
And do you need doctor's orders?
And I bet you could probably just go to one and ask. If not, you could use a doctor's order. That doesn't answer
you don't
anything.
know.
I don't know.
Okay.
I don't know.
Okay. And then a vitamin D question from somebody is, which do you recommend? Which one's better, vitamin D3 or D2?
D3 is active. D2, it needs to get either converted into D3 in your kidney or your skin via sunlight. We're not very good at that anymore, especially with the lack of sunlight. So just take D3 with fish oil or fat or food, because you need fat to absorb it. Some people will do an ADK, which is all the fat-soluble vitamins, and there's some added benefit for doing that. But again, we have to watch the amount of A and the amount of K. So.
Okay. So the person that asked this question is taking 50,000 of D2, but they didn't say. I'm assuming that's daily. That seems like a lot.
Yeah, I don't use D2 in patients. So 50,000 units of D3 weekly would be a standard dose, but I don't know about D2.
Or 5,000 a day.
Or 5,000 a day of vitamin D3 daily. I said that redundantly, sorry.
Okay.
All right, thank you. Sorry about the intensity of the authoritarian stuff, but we need to wake up. The biggest problem with COVID isn't COVID now. It's the destruction of American society, lack of freedoms, socialization. Oh, big shout out to Michael's Grill, where they were all masked up. The food was great for business dinner, and we went to Rococo. People were out. Everyone was masked up, and the staff, and the food was great. A great service at both places. But I mean, people need to start, getting back to life. Sorry, got to do it. Don't use this as the excuse to hibernate the rest of your life and lose your friends. Get out there with your mask.